Georgia is the buckle in what is known as the stroke belt, the name given to a 9-state region in the southeastern United States recognized by public health officials for having a higher rate of stroke.
It isn't clear what makes it the stroke belt. There are many factors. Maybe nutritional, access to care, socioeconomic, race, genetics, those things, they all interact and create this phenomenon that's been known about for more than 30 years.
Some of the risk factors for stroke include smoking, hypertension, diabetes, high cholesterol, obesity, sedentary lifestyle. Hypertension and smoking account for over 50% of all strokes. Ischemic stroke is the most common type of stroke. It is usually caused by a blood clot, also called a thrombus, that blocks or plugs an artery in the brain. Thrombectomy is the mechanical removal of that clot. Transient ischemic attacks, TIAs, they occur when the blood supply to the brain is interrupted briefly, causing stroke symptoms for only a few minutes. Having a TIA can mean you are at risk for having a more serious stroke. Hemorrhagic strokes are less common, making up 15% of all strokes, but they're responsible for about 40% of all stroke deaths. A hemorrhagic stroke is when either a brain aneurysm bursts or a weakened blood vessel leaks. Blood then spills into or around the brain and creates swelling and pressure, damaging tissue in the brain. Surgery may be needed to repair a rupture, stop the bleeding, or alleviate pressure from the accumulated blood. Both types of strokes kill brain tissue, so it's important to remember the saying, time is brain. With that in mind, people need to think fast, and this acronym is an easy way to look for symptoms of stroke, such as sudden weakness on one side of the face, or sudden weakness in an arm, or difficulty speaking. With any of these symptoms, time is important, so call 911. The good news is there are things you can do to prevent a stroke. One of the most important is to lower your blood pressure if you have high blood pressure, also called hypertension. You can do this by reducing salt, avoiding high cholesterol foods such as burgers and ice cream and donuts. Eat 4 to 5 cups of fruits and vegetables every day. Exercise for 30 minutes a day, more if possible. Taking medication is often needed to control high blood pressure, so a regular visit to your primary care provider is absolutely critical for preventing a stroke. And if you smoke, quit. Even if you've smoked for years, stopping now will reduce your risk of stroke. Lose weight if you need to. Eat less and move more. If you drink wine, beer, or other alcohol, do it in moderation.